On today's panel, we have Dr. Julia Getzelman, MD. She founded Getzwell Pediatrics in 2008 with a passionate commitment to bring pediatric functional medicine to San Francisco. Dr. Getzelman graduated with a bachelor's degree in psychology from Stanford University with distinction and Phi Beta Kappa. She later earned her medical degree from Yale University and completed her residency at Children's Hospital in Oakland. Dr. Getzelman believes that many factors contribute to health and illness: nutrition, physical activity, emotional, psychological stresses, and the environment, among others. To that end, she completed the core curriculum of the Institute of Functional Medicine in 2007. Dr. Getzelman has additional training in homeopathy and applied nutritional biochemistry, food as medicine, as well as using genetic polymorphism as a guide for treating a variety of chronic problems like ADHD, anxiety, behavioral issues, autoimmunity, and others. Dr. Getzelman grew up in California and is the oldest of 5 children. She loves the outdoors and is fascinated by nature. She comes from a musical family and has sung in a variety of venues over the years. She has a passion for the Romance languages and is fluent in Spanish and Italian. Dr. Getzelman lives in San Francisco with her husband. My name is Olga Rosales Salinas, and I'm here presenting the San Francisco Bay Area Moms Bloom Event and Expert Panel. Every year we present Bloom in support of new and expecting moms. In the past few weeks, we've asked you to submit questions via our social media handles, and you've submitted them. So this is what we're going to be going over today with our expert panelists. Today, we have Dr. Julia Getzelman, MD. She founded Getzwell Pediatrics in 2008 with a passionate commitment to bring pediatric functional medicine to San Francisco. Dr. Getzelman graduated with a bachelor's degree in psychology from Stanford University with a distinction in Phi Beta Kappa. She later earned her medical degree from Yale University and completed her residency at Children's Hospital in Oakland. Join me in welcoming her. Hello, Dr. Getzelman.
Hello, so great to be here, Olga. Thank you.
You have an awesome resume that I'm going to read a little bit later on, but I wanted to get as many questions in from the audience as we can.
I think that was plenty.
Okay. So I guess I want to ask you first, like why start your own practice? Why San Francisco? Can you give us a little bit of background into your practice here in San Francisco?
Yeah, I'd be happy to. Well, I was living in San Francisco, and I was working for a corporate entity in a clinic. And after about 5 or 6 years of that, I started to feel like I was just a cog in a kind of a broken system. And it didn't really matter whether it was me or the next kind of warm body. I had no say over how the office was run or how patients were treated or spoken to. And it just began to feel like, really, I was miserable. And I think simultaneously in that last year of practice in that setting, conceiving of a practice that I would want to go to, or that I would want to take my children to. And I also was introduced to functional medicine, which is really root cause medicine. And that felt like coming home. It felt like the thing that I had been waiting for my entire medical education. And so that gave me the confidence and inspired me. And when I say conceiving of this Getzwell practice, it was almost like I was pregnant with this idea and it had to be born. And that happened in the beginning of 2008. So I am now the parent, shall we say, of a almost 16-year-old. So that was 2008. And now we're in the end of 2022. So yeah, that's a little bit about how Getzwell was birthed.
Yeah, so I didn't get a chance to read the other half of your resume, but you do have really interesting education in applied nutritional biochemistry, food as medicine, and you apply that and you look at chronic problems like ADHD, anxiety, behavior issues, autoimmunity, and others. Can you speak a little bit about that part of the practice?
So my passion is kind of being the Sherlock Holmes, if you will, and looking underneath the surface for causes of things that are labeled ADHD or labeled anxiety. I give you an example. 6 different kids can come to me with an ADHD diagnosis or label, and I can find that they got there very differently, and that if we understand what the root causes are underneath that label, we can often remove the label, believe it or not. I mean, not always, but one of my passions that's rooted in functional medicine is applied nutritional science, meaning that food is medicine and the gut is the foundation for overall health. And so one place that I often begin with a patient is to look at the status, to look at the health of the gut. And, I don't know how many tens of millions, hundreds of millions of Americans have gut complaints as a primary, issue. And it starts in childhood, unfortunately, at this point in human evolution on this planet. And so there are a lot of things that, believe it or not, we can do to intervene to support optimal health and to avoid needing to use medication. And so that is my passion, to avoid the use of medication whenever possible. But you have to, you have to look deeply, and you have to kind of know, you have to use the lens through which I see things. And I was trained to see things through the Institute of Functional Medicine in order to get at these root causes. But it's super exciting. It's super
It sounds really exciting. Yeah. One of the questions we got from our audience was about a pregnant mom or a new mom nursing, and the connection between what she's eating, what she's drinking. If you had any best practices, since we're talking about gut health in babies, do you have anything that you would suggest to this mom that submitted this question?
Well, first of all, my hat's off to all moms, because being a parent is the hardest job you will ever have. You choose it, and you don't lose it. And second of all, breastfeeding is something that I and Getzwell and the other providers in my practice feel very strongly about. A factoid about breast milk that I love is that women expend huge amounts of energy putting what are called human milk oligosaccharides, HMOs, into their breast milk. And those HMOs are plentiful in breast milk, but they don't feed the baby. The baby cannot digest the HMOs, the human milk oligosaccharides. So why are they there? Nature doesn't, waste energy on this kind of effort. So they're there to feed the bifidobacterium species that are supposed to be in babies' bellies. And so nature has provided for the nourishing of this particular species of bacteria that help a baby's immune system to optimize over the first months and years of life. So that's one of my favorite factoids that I like to share with new moms. Fun, yeah. And then, what I say is eat the way that you want your baby or your child eventually to eat, because the food that you eat flavors your amniotic fluid while you're pregnant, and it flavors your breast milk while you're breastfeeding. And so babies will develop preferences for flavors that they've already experienced both in the womb and in the breast milk. So if you're eating, a lot of sugar and processed foods, then that may be what your baby is primed to want to eat later. And so because I believe that a whole foods diet is, super important in terms of gut and microbiome nourishment, that's what I would encourage. And then there are, certain examples of babies that are fussy and have digestive challenges in the early weeks of life. And in some cases, a mom needs to eliminate dairy products, for example, or in some cases, a woman may need to eliminate cruciferous vegetables like broccoli and cabbage and cauliflower and the things that we kind of associate with gas. But I would say generally eat the way you want your baby to eat, and good for you for making the effort to breastfeed, because it will pay off in your baby's long-term health.
What about moms who aren't able to breastfeed and they have to go?
So absolutely. So fortunately, in the last few years, there's been kind of more widespread information about the components of breast milk. And so formula manufacturers are actually starting to be able to put components that we understand are in breast milk into the formula, and to try to compensate for the fact that, there are moms who, for whatever reasons, are not able to breastfeed. So there are some pretty good, mimickers out there.
That's awesome. That's good to hear that as a pediatrician, you support that, support the formula. I'm curious because with the formula shortages, there's a lot of moms that were donating breast milk to other moms in order to supplement. Would you suggest that as a pediatrician, or is that something you would stay away from?
Well, I think, my kind of, gut response to that is that you probably, thank you, moms, for sharing your breast milk. And, you need to disclose what medications you're on and whether you're using any recreational drugs and things like that. So I think that, there's a place for that. And, there's a certain amount of, caution that a mom taking that breast milk in for their baby would want to exercise.
Do you think that, I guess that question is about what's happened because of COVID and all the backlog of supply and demand and everything, but is it also related? Can we talk about COVID and the vaccines and
Sure.
how early you suggest them? And would they be do you think that those start being part of the regular set of vaccinations that our babies already have to get?
That are required?
Yes.
So the vaccines are only approved down to 6 months of life at this point. This virus has behaved very differently from other viruses in the sense that, usually kids and the elderly are the hardest hit when we're talking about things like flu and other serious viral infections. So this virus, it turns out, is able to infect kids, and kids are able to infect us, but the kids seem to be the hardest hit. So that's a blessing in my mind, because as crazy and horrible as this thing has played out, can you imagine if the number of kids had died, as we've seen adults?
Right.
So in terms of the vaccine, we know that it helps prevent hospitalization and death. Kids during the Omicron wave were certainly hospitalized at much higher rates than any of the other waves because it was so infectious and there were so many more kids infected. So, for those who want to avoid serious illness and hospitalization, definitely recommend, COVID vaccines. Hands down for adults, but for kids, we know what the vaccine is capable of. Unfortunately, we don't have a nasal vaccine, which I think is kind of what I'm looking forward to in terms of being able to stanch this, infection and spread and more mutations. So I'm hoping in the next couple of years that we actually see a nasal vaccine come through, which would help to make life even more normal.
All right. Do you see like San Francisco moms and dads bringing in babies as young as 6 months old with COVID, or wanting to get vaccination for them already?
Both, yes.
Both, yeah. That's good. Good, positive. This was a question that was on our list, and maybe you can speak a little bit to this. I remember when my kids had belly button issues. What's the best practice of treating belly buttons, and have you seen anything change in the belly button game in all of your years of practice?
So yes, basically when a baby's born, obviously the cord between mom and baby has to be cut, and so there's a stump that's left behind that then has to separate you know, and then it ends up forming what we call the belly button, where it falls off. We used to tell parents automatically to clean the base of where the cord is attached to the belly with alcohol. It turns out that alcohol destroys some of the important cells that are needed in order to facilitate that detachment. And so we don't tell parents automatically to clean that. We just say, wait until, you know, it falls off. And then you can clean, because there's often some dried blood or some dried serous fluid, which is that kind of yellow, crusty stuff. So once in a while, the base of the cord is down kind of low underneath the skin that is around it of the abdomen of the belly, and it gets super stinky.
Yes, I remember that.
So I tell parents, if it's super stinky, then you can take a Q-tip and clean around the base. And I show them, you know, we often do house calls, so I'm often at a parent's house, you know, showing them how to potentially clean. And parents get all wigged out about, you know, the stump and the cord that's left, but it's really dead, and the abdomen is absolutely sealed off from, you know, the cord. So we're just kind of, it's almost like you're kind of just waiting for a scab to come off.
Okay.
So that's kind of
I was one of those parents that was overly concerned about the smelly, gross, and like, am I ruining my kid's life? It's going to be an outie forever if I do this wrong. You know, new baby smells are just
yeah. And no, you never think you're going to be so interested in poop, and then you become a parent and you're all about it.
Yes, and you're looking at color schemes on the internet and why this color green and all of the things. What can you give me as far, or give our listeners here as far as advice for a new mom that's maybe experiencing some baby blues, some postpartum depression, or just feeling like really overwhelmed? I know you mentioned, you know, trying to stay away from medications, especially if you didn't say this, but if a mom is breastfeeding, how would you do you have any advice for a mom that might be experiencing that?
Listen, like I said, being a parent is the hardest job you will ever have. It's, you know, and every baby, every child is different, and kids don't come with manuals. So, you know, it's really important. Well, for one thing, I would say, don't feel bad because you feel bad. You know, it's okay to reach out, you know, for help, and to lean on friends and family, and to bring it to the attention of your own doctor or your baby's pediatrician. At Getzwell, we automatically do a screening at 2 weeks of life, because we see the baby at definitive intervals, and that's true of any pediatric practice. The visits are very lockstep in the first, you know, few years. And so if you're feeling a persistent and prevalent, you know, state of depression or blues, please, you know, go to somebody you trust and let them know, because there are things that can help. And sometimes just saying it is helpful, and having it be normalized is helpful. But I would say that, you know, sleep deprivation can contribute to that a lot. And newborns don't always sleep on the same schedule as the rest of us. They don't have that circadian rhythm. They don't understand that day is day and night is night. So your newborn might sleep during the day and be like fussy and up all night. And so, you know, what I try to encourage parents to do is to sleep with the baby, you know, sleep while the baby is sleeping, to get as many of those Z's as you can in. And don't be, you know, try not to be too hard on yourself. Again, this is tough stuff. Like, and, you know, and really we should be raising children in a village, and we don't live like that anymore. And so it's, you know, it's really even more important to have some trusted adults, doctors, you know, other people that you can go to.
Yeah, I remember experiencing some baby blues and my doctor saying that sleep was just as important as what I was eating, not just because I was breastfeeding, but because it really made a difference to my sleep. So if I had like really heavy meals all at once, that would interrupt the few hours I was getting. So it was just, I just remember thinking like, wow, it's really all connected. And, you know, what I'm feeding my baby breastfeeding, it was a eye-opening experience that first time around. I feel like I did it better the second time. I don't know if I'm the only mom who feels like that, but
No, no. I mean, I sometimes a mom will come in with a second baby and it's like she is unrecognizable
yes.
compared to who she was with the first, you know, and it's all, if you know, it's all new.
Yeah.
You know, and we don't have our mothers and our grandmothers and our aunts around to guide us.
Exactly. Thank you so much for being here, for being part of the San Francisco Bay Area Moms tribe, and for joining this panel now a few years in a row. And we hopefully we'll get to see you at the Bloom events, October 8th.
I hope so. Yes.
Okay, good. Our audience here is going to be able to have your resources. They're going to be tagged here, and so they can reach out to you if they've got any questions about anything that we went over. But thank you again for everything that you shared today and for being this well of knowledge for all of these different things.
Thank you, Olga. I really appreciate it, and I loved our discussion.
Thank you. Have a good day, everybody.